Let me start with the obvious question. Is patient matching still a problem, or have we solved this? I mean, it is 2021. Patient matching is solved, right?
Seems pretty simple, right? About like voter ID, man. Like it somehow became a political problem a long time ago and not just a technology and a people process problem, and so I'm a great example. So my name is Edward Ricks. For my entire life, I get called Rick Edwards, Ricky Edwards. It's just one of those things. And then you probably know there is a Rick Edwards that's been in healthcare IT for the last 25 years, bouncing around like me. And we used to get each other's email from vendors all the time because you start the autofill and it goes, and just like that, it's gone. So, clearly there are some technology solutions. It is process though. It's people and process. The read back, all that stuff makes sense. I don't know if you guys played around with any biometric authentication at registration points of entry. That can help. Some people are worried about that and scared of it. I don't understand the pushback of a patient ID, a universal patient ID. That would help, right? But there are so many like points of egress to make the mistake. So registration is one point, so you could make an argument that that's maybe one of the most important roles in an organization. And I will also counter argue this probably one of the lowest paid roles in an organization. But getting that information correct from a clinical perspective is one thing. From a financial perspective, from a billing, medical records, claims process, all that stuff is just a critical job, and it's complex all the time. So you've also got the families with multiple people with very similar names. You've got people who will lie because, my brother has health insurance and I don't, so no, I don't have any ID, but my name is whatever, so there's a host of reasons I think that it's a problem. I like the biometric. That can help. That's not the only answer. And again, some people won't use that or don't like it. I don't know why it's still a problem. It is still a problem. But it's also a problem after registration. I mean, when you're taking care of a patient, you still got a clinician at some point selecting the patient. Now, a lot of the workflows sort of make that almost fail-proof, but it's not. And it happens all the time. Select the wrong patient, do orders, and it's done.
Ed, I'm sorry, I'm giggling over here. I'm giggling because it's still a problem because it's interesting to me. We did a lot of things. One is, yes, it is one of the lowest paid people doing the process, but anytime you have the lowest paid people doing the process, you put in systems that have checks. And so we used, I think it was called Initiate. IBM had a thing called Initiate, and it did patient matching on the fly. And so if persons tried to put you in as Rick Edwards, it would look at the information and go, we have a person that looks an awful lot like this person named Ed Ricks. Are you sure you want to create another record? And then they would go, yeah, they're flying, they're trying to do it as fast as they can. And it goes a little further. And there was another one that would pop up and say, no, we're pretty sure this is Ed Ricks. This is not Rick Edwards. Are you sure you want to do this? And they would go, yeah, go ahead. You know what? If they said, yeah, go ahead, that created a log file that went to their manager that said, hey, they created a new record and we told them twice that we thought this was this person. Now it was that manager's job to validate, is Rick Edwards Ed Ricks? And if they said yes, then there was a training initiative that had to happen for that person. Hey, you're working too fast. You're trying to move too fast. Or do we have too many people lined up in the ER? Do you not understand the job correctly and all those other things? I mean, like you said, it's people processing.